start soon. And then it's 11:30, but she said, don't worry about it if you don't want to come. She'll just cut out that part. So that was good to know too. Yes, isn't that nice? You don't have to worry about that. Okay, so I'm ready before you. I'm gonna go hang that sign.
I think this is looking pretty good. I'll just leave this like this, and then I can sit somewhere near here so I can keep an eye on it.
And I was gonna ask you for the remote people, so you're monitoring them, like if they have questions and stuff. Ask them to put their name, organization, and email in there, because we haven't already signed it. Yeah, okay, that'd be great.
Mhm.
Okay, back. That table over there is Quinn's materials. Okay. Some clergy stuff. Put on the table.
Yeah, I think the owl's going to do its thing very nicely right where it's at.
Awesome. I'm talking over here. That's showing.
It shows you.
Awesome.
And me leaning over.
Did you get everything put on the table up here you wanted? No, I got these two things. Workshop and everything stuff. Are you caught up too? I think so. Okay, well, maybe I'll have you go do the sign then. Yeah, I can do that. Okay, okay. You all don't mind if we get started? Great. If you grabbed a hard copy, you signed in, wonderful. And I'm Chris Blocky with Four Corners Health Department. Fortunately, most of us know each other in the room, which is wonderful. And housekeeping things is there are bathrooms right outside the store in a little hallway. Jacob works and lives and plays here, so he knows where everything is. And water fountains are out that way also. And we picked this space. We knew it was larger than what we needed, but you can spread out, you know, we have things going on these days. So you can spread out as much as you want. And the seats are comfortable, which is really nice and easy to find. The presentation, Quinn's talk is being recorded, so hopefully you're all okay with that. Then after this, we'll have the report posted and the recording posted also. So please feel free to share with others. Once after this is done, we plan to have this all shared very widely with whoever is interested. We're asking people to sign in here, and those joining remotely, welcome to you also. And please put in the chat box name, organization, and your contact information. Everyone who participates today will make sure the report gets emailed to you also. Just or hopefully. Sarah Kelhake is in the room here with us, and we work closely together. So she's monitoring Zoom and the slides. She's our Grand Central hub right here. Before Quinn gives his great presentation on the report, we're so thankful for this. I just want to lay a brief foundation on what brought us to this point right now. Starting at federally, maternal child health has been an important issue. It's one of the longest funded grants nationwide. They offer, and then the state does an assessment every 5 years on the health of maternal child health. Normally, it's been early childhood, pregnancy, things. Last time around, after they did their statewide assessment, one of the 5 priorities that came forward was the state of youth, especially 10 to 19-year-olds. So in their research, they found that 10 to 19-year-olds were at higher risk or challenged with suicide. So that priorities, Four Corners applied and received that sub-award. Assessment is part of our work, and his team, the UNL Public Policy Center, agreed to partner with us to accomplish the assessment. That is part of our 3-year project, is to figure out where we're at right now, what do we need to do, where do we want to go moving forward. Many of us are involved in youth, preventing suicide, their well-being, individually and collectively. We're working together. This project, we're hoping, our strong goal is that how can we move forward more comprehensively and have greater strides toward the well-being of our youth in all ways, physically, emotionally, in all ways. I want to introduce Quinn. Quinn and his team have been a wonderful partner, just going over backwards, helping us, supporting us, really setting us up for success. And I'll let you talk about your background and your title and all that. Sure. But please join me in welcoming Quinn.
As Chris said, I'm Quinn Lewandowski. I'm a senior research specialist from the University of Nebraska Public Policy Center, where we do quite a wide variety of projects and community engagement, about everything that you can think of. Also joining me today via Zoom is Dylan Saunders. Dylan will probably jump in as well. Dylan, do you want to introduce yourself?
Yeah, absolutely. Hi, everyone. My name is Dylan Saunders, and I'm a research specialist here at the Polk Policy Center.
And Dylan did a lot of work in this report, as well as the focus groups, as well as the survey, some of our efforts here. So definitely a great resource as well. A bit about my background. I have been involved in behavioral projects over the past 7 or so years. More importantly, been really involved with the Nebraska State Suicide Prevention Coalition over the past 7 years. I'm the current sitting president of the coalition, and we're very happy to have grown that over the years and can continue to focus on statewide suicide prevention and how we can better support communities and local areas in very different ways. One of the primary ways that, especially to make that happen, we offer mini grants, usually from $500 to $3,000 for communities, nonprofits, behavioral health regions, health departments, etc., to carry out those little tiny projects. Oftentimes, it takes a little bit more searching for funding. So that's a little plug on that. Pretty soon, a new round and opportunity is going to be coming available. If you have any questions on that, feel free to catch me or contact my information. Happy to share that opportunity when it comes available. So I'm going to have Sarah share out the link for those online where you can access the report. Dive deep into that. It's 38 pages, but I trust you, it's not that scary. The main meat of it is 21 pages or about 20 pages, and the rest are like a little bit more in depth on our survey results, as well as there's a copy of like the focus group prompts and stuff of that nature. So just wanted to make sure it was comprehensive, and then this is a document that can live in a few years if you're doing another assessment. So we'll start off, and I'll have Sarah advance the slide. So again, as Chris mentioned, this is the part of the MCH walk grant, specifically focused on youth age 10 to 19. So as we know, that's a pretty age ranging from a little bit of elementary school to middle school to high school age. So we really focused in on those particular demographics. And of course, there's a really tiny blurb about the grant at the very bottom. If Chris wants to radio speed read through that, she can. But if you're seeing it on screen and want to read that information, really kind of reiterating that our speed or anything that we're talking about in this report really comes to us in our no reflection of HRSA and the U.S. Department of Health and Human Services. So in opening up the report, and next slide.
Sorry, welcome.
Well, anyways, especially as we in doing this health assessment, there were two primary efforts that we kind of did. Number one, we did a risk and protective factors analysis. So with risk and protective factors, this is really just looking at potential things that could influence ideation and mental health, as well as help support our youth along their way. Those protective factors, are a variety of things: connectedness, access to care, etc. So, looking at that, those are some of the specific ones that we looked at: physical activity, access to care, health insurance coverage, risky behaviors, violence, bullying, mental health, and then qualitative data, which makes up the second half of the report, is a good summary of both our community health survey that was carried out online for 2 months, and then our focus groups. We held 6 different focus groups over 4 time periods and received a lot of great stakeholders, parents, and people that live and work in the Four Corners district. So very happy to have that come all together. So next one, Sarah. And then on page 4 and 5, you can find some of our resources, what we use for the data, but especially in diving into the risk and protective factors analysis, which starts on page 6. We found that there are high rates of community connectedness. Oftentimes, Four Corners was above average according to the Nebraska Risk and Protective Factors Survey. That more often than not, youth within the district were above the state average in reporting that there was an adult at home that listened, as well as an adult within school that would listen or support. And that adult in school could be a variety of different people. It could have been a coach, a teacher, a principal, a counselor, etc. As far as some of the risk factors that we found that were particularly interesting, a lower access to exercise opportunities. There was a significantly lower ratio of population of primary care physicians, and this was more prevalent, especially in the northern counties. So Butler and Polk especially had some significant ratios on there, and just kind of jumping into that and looking at kind of statewide ratio of primary care physicians. It's about 1,300 to 1, where Seward and Polk had slightly lower rates of 1,920 to 1 and 1,740 to 1. Also with mental health providers, the state has about a ratio of 340 to 1. Seward and York had 570 to 1 and 640 to 1, whereas Butler and Polk, being more rural and probably remarkably more skewed, had Butler being 7,960 to 1, and with Polk 5,200 to 1 for the latter. So lower population, so those are probably those counties are likely going to have to travel longer to receive mental health services. And especially of note, with the Four Corners community health assessment that they carried out in 21 and 22, that about 43% of those respondents reported having to travel over 25 miles to access mental health care, which was pretty interesting, with about 16% of those individuals reporting that it was 50 miles plus. So something of note there, just that extra barrier to coverage. And I also saw that in the health survey that often people said that there's kind of a lack of variety within the local community. If, sometimes if you didn't drive with a therapist or whatever, you often had to go farther out of the community to access those services. Health insurance coverage, that was another thing that we looked at. And pretty much Butler, Seward, and York, and looking at uninsured children, the majority of those fell with under the state average, so looking good there. But Polk County was higher than state average at about 7.3% of their kids, 7.3% of their kids being uninsured or not having access to. Risky behaviors was another thing that we looked at. This with alcohol, tobacco usage, other things of that nature. There was also some reports, especially higher rates of mood disorders, bullying victimization, and suicidal ideation that we found within there. And most of that data came from the Nebraska Risk and Protective Factor survey. And especially that particular survey is great. There was just one done this past school year. That information will be available in the near future, but unfortunately it was not available in time. And then we did look at the suicide completion rate data, both for the whole community as well as youth, that is typically defined by the CDC in the 10 to 24-year-old range. So there were some fluctuations. There were some years where it was 0 in certain categories for youth, but then there were also some dramatic spikes where it was up to about population analysis, so we can compare area to area. And so we do it per 100,000 people. So in some years for the district, it would spike up to about 32 per 100,000. And thinking about like our average youth suicide rate over the past 5 years, it is around 14.1 per 100,000. For the state average, Four Corners for the last 5 years, from the available data from 2016 to 2020, was actually a little bit better, but obviously those can fluctuate quite rapidly over time. But lots of, and especially that could be due to a number of factors, having that little bit better rate, effectiveness, and other things of that nature. It's a lot better family support and willing to engage in care and other things is especially really good. Yeah, so already talked a little bit about the connectedness. Now we'll skip forward. Dylan, do you want to talk a little bit about our methods with the qualitative data?
Yeah, absolutely. So we conducted a total of 6 focus groups. We did 4 focus groups, and then 2 of them had enough participants to split into 2. So we had 6 total. They lasted approximately 1 hour each, and we conducted these over Zoom over a period of about a couple of weeks. They had 6 to 10 participants each, and included a wide variety of community members and individuals who lived in these counties, covering a fairly broad range of organizations and departments. And after we had finished conducting and recording these focus groups, we sent the transcripts off to a third-party software for transcription. And from there, we were able to carefully comb through each of the transcripts and code it for prominent themes. And in addition to this, we had also distributed a survey that asked a fairly wide variety of questions about mental health resources and access and youth suicidality in these 4 counties. And in total, we had 232 respondents to the survey, which is a fairly significant number. And the survey also included some qualitative questions that just asked about resources and accessibility and barriers and things that might aid access to mental health resources. And we use these qualitative responses alongside the themes that we got from the focus group to find overall themes for these 4 counties when it came to availability and access and mental health resources, specifically for youth.
Yeah, and especially on the survey with the 232, we also drilled down of those 232, the 195 of them live in the Four Corners districts or North Seward, Butler, and Polk. So we really focused in on those answers. There were also some key questions that asked about if somebody or a guardian of somebody aged 10 to 19. There were a few extra questions that were drilled down to them on thinking about their child or young adults' mental health, some other good things there. So there were some key themes that were kind of echoed a little bit from our risk and protective factors analysis. And it's definitely worth reading from page 12 to about 21. Some of those good things. Pulled out some great quotes from people. Oftentimes, access and availability was a big one. A key thing that a lot of individuals mentioned in both the survey and focus groups was resource availability outside of the school year. So oftentimes, some people felt that when their child was in school, they were able to engage with the counselor and get connected with the behavioral health services a little bit easier. When the school year ended, oftentimes some people, and this could have been from a variety of different areas, they didn't have that same support. So it was about 2 or 3 months or equivalent care for their child. So other things, a lot of people spoke to the lack of available providers, as well as some of the wait times, just kind of that general kind of push and pull there. Also worth mentioning, and this is maybe something that we can focus on as from results of this culture and stigma. There definitely still is stigma around mental health as well as suicidal ideation. So there's a variety of different examples that were provided of stigma, and I mean, walking through that, oftentimes in communities that their child was afraid to even let anybody know that he was seeing a therapist or seeing a counselor, talking about that no way that anybody would park in front of the therapist or counselor or behavioral health providers, local behavioral health providers building, because they didn't want anybody to see their car in front of there. So, I mean, that's a considerable thing to consider. So maybe especially examining how times it was brought up that especially in those teen years, which we all know are fun and more normal, not fun, but especially a lot of onus on privacy, keeping that privacy, as well as just not a willingness to let anybody know. So that was interesting. Also kind of echoing some of the risk and protective factors analysis, the insurance process, the paying for their services is an issue for some. So, and then the geography and the travel to services. Dylan, anything that you would like to mention, especially within that qualitative analysis?
I think you covered all the primary points that we had there. The general availability of resources was one big recurring theme that we saw a lot in both the focus groups and the surveys, especially, both in terms of the geography and travel time, but also just the density of resources too that we had in these communities, especially more rural or smaller communities. And that ended up being a fairly large barrier, according to a lot of our participants, for getting the help that they need when they need it.
But again, definitely recommend at least reading book 21 to kind of look at what your community is saying, and kind of giving some good examples on that. If you want some more examples of just some of the results that we got from the online survey, that is included on the report. It starts, we've had some qualitative open-ended questions. Starts on page 25 and goes quite a bit. You can see every single one. So all non-biased, some general feedback on different issues that people brought up. So lots of qualitative data that we went through, coded, and found those themes, but I guess I would open it up for questions. And if you're online, you can feel free to unmute or speak up or submit it in the chat to Sarah and she can read it for you. I think more than anything, with this report, this provides a good baseline of where you are now. I think especially, and I'm sure Chris can speak to this, what particular issues within this report are easily addressed? What are some of those low-hanging fruit that you all see that we can start taking steps to address? Obviously, Four Corners with this grant have been doing some outreach, sharing the lifeline, other things of that nature. But I think especially addressing that culture and stigma could possibly be one. From my experience, obviously the health insurance one is a big monster that would take years to impact. But feel free to speak up if if you found anything particularly interesting in just briefly summarizing or reading through the report, or go ahead.
I just hopped on and saw this little thing regarding colleges. I'm from Blue Valley Behavioral Health, and where we run into problems is the state of Nebraska, legal age to sign things is 19. So you have college kids coming here, and in their states, they are legally able to sign stuff, but then we have to try and get a hold of their parents. That slows the process down, and then also the parents are aware of receiving services. But yeah. And I don't know if people are aware, Region 5 does allow for like Blue Valley nonprofit organizations that include their family and other places, that if the insurance deductible is super duper high, they may qualify for sliding scale fee until they hit that deductible. The bad place to be in is if your insurance covers of it, because then you can't use the sliding scale fee. Or if somebody has no insurance, we can use sliding scale fee.
And that was especially addressed a lot in participants of just figuring that stuff out. It was often tough with parents and balancing life with their kids and work and trying to figure out the system of how they pay and access services efficiently. So that was one key thing. One other thing that I also found interesting, we did ask within survey on willingness, if somebody was suicidal, to engage them and ask the question, suicidal and connecting them to resources. It was profoundly positive, and people found themselves very confident or to be able to that was at risk for suicide. So the big ones, other things that we saw that jumped out to me very early on in the survey, and it kind of continued to be kind of theme, that a lot of people wouldn't know where to go for services initially. So especially, I think, and we talked about that, and it was kind of echoed in the focus group as well, with our behavioral health providers. How often are we tooting our own horns or have a gigantic sign with flashing lights and saying, get behavioral health services here. But I think that's another key thing of educating our public on where you can receive services. There are a variety of different things that are going on within our state as well as our nation to help improve access and connectedness sources. The Lifeline, which is morphing into the suicide and crisis line, as of Saturday, July 16th, it will on July 16th, it will become 988. And with 988, some of you may already know, it is a great, monumental, awesome change, a very once in a lifetime opportunity that we see something like this happen. But with 988, the goal is to morph that crisis line system into kind of a free all throughout our state as well as our nation. So anytime anybody calls in to 988, calls or texts, somebody will respond in case there is a crisis and they need additional help from a crisis team and somewhere to go. So ideally, hopefully, if somebody is in a fire crisis and needs a place to go, they can help direct and connect those services. Obviously, doing that in a 2-year time frame and figuring that stuff all out of the state is a challenge. I think, especially our more rural areas, such as the Panhandle and up north, some of those pieces in those final two spots of someone to respond and somewhere to go, just due to the geographical issues and provider issues that those areas face are a challenge, and hopefully those can be continually improved as 988 is implemented and evaluated here within our.
Well, we want, oh, go ahead, please.
Have you, some of your research regarding the first generation kids? I don't see so much of that in Seward County, but also in some population of these are they're actually being in the United States and having some of that cultural between the two places.
We didn't see it pop up too much.
You might try.
Can you question for those online?
Yeah, so, and I'll kind of paraphrase, you can nod or shake your head. But the question related primarily to our first generation Americans here in the Polk area. And if that was kind of especially, I think what we saw, especially with the online survey, sources, low income, different cultures and demographics, LGBTQ, A+U. That was primarily what we saw with it. If we didn't in good format. And some of the other feedback, but that's also with the population analysis population is identified. So very much minority. So those minority voices.
I think we're going to have to bring you closer to the owl.
Are there any more questions for Quinn? And we just wanted to touch base real quick on next steps also. But are there any more questions for Quinn or questions, comments? I'm happy to stay a little bit when we're done too with their individual.
Yep. And even on Zoom, if things pop up, again, if you have further questions or as you read through and digest things a little bit more, feel free to email myself, Dylan, and Chris, and we're happy to especially talk more about the analysis, and especially as we talk about where do we go from here, further talk about that. But I really appreciate you guys being here and wanted to see what we found throughout our analysis. So.
We wanted to also touch base on next steps. So what do we do now? We have this great information. And Dylan, Quinn, thank you so much for all the writing. It is important. And all the data that they gathered and assimilated into one report, that's wonderful. So for next steps, we're following a model. So Dr. Don Vila, a psychologist, suicidologist, is also partnering with us on this project. And he helped to facilitate, and Quinn, you might be part of this also, in Lancaster County, a coalition that is focused on, I think it started with youth, but now it's more widespread on ages, for helping to address, theirs started out with crisis. We're going to be using that model. He's going to help us to do that model in our area. So we're going to be having a district-wide coalition Mallory has agreed to serve on that. And then we hope to have about 10 to 12 people start us off with this, looking at the data gaps, all the things that are very important for us to look at. What's needed, who do we all need to bring together, where do we want to be after, in another 3 years, how do we sustain the work, support the work, the key issues, how do we address those well, how can we work more comprehensively within our communities and not in silos, how can we reduce stigma, how can we engage parents? That's another key area when we were talking about how do we support parents, engage parents. So that's our next step, is to have that district-wide coalition. Also, we're doing education, outreach, and training in this initial phase until more things are put in place. We're starting COPE squads and Centennial starting on this fall within our district. So then all the public schools and St. John will have a COPE squad. And then there are others throughout our district also, which is wonderful. Also trainings for school counselors, parents, clergy. So we have a variety of things going on that we're hoping to engage more support on this issue, reduce stigma, make a difference. Insight. I think as we wrap this up, and please stay around if you want to chat more or have questions, but realizing we all have a role in this. And thank you, the all-day time, each of you, as I look at each of you, you all have a significant role with the youth, families, parents, health of our communities. So thank you. How can we keep engaging people to realize they have a purpose? Each of us in our communities has a role in the youth well-being, and we each can make a difference. So I want to thank Dylan and Quinn again, if you don't mind joining me and thanking them.
Like Chris was talking, I thought of more things to mention. I think especially the faith community was another thing that was mentioned. Further engaged in how we reach people, because that's often faith is especially something that a lot of us turn to, as well as our pastors, priests, other things of that nature. How can they better engage with our population? Other little things that are being done in the background at the state level. The Nebraska Department of Education just released a kind of a school resource manual related to suicide prevention. And you can easily find that if you Google Nebraska Department of Education suicide prevention. They're also, my organization is also assisting in kind of a parent guide that is, if a parent is feeling like their child is depressed, some general things on there and how to access a mention of screening tools, national and local resources, other things of that nature. That's also kind of a good, should be popping up on the same website that the Nebraska Department of Education School Resource Guide is on. But yeah, thank you so much. Again, thank you for being here as well as online. Sincerely appreciate that. But especially if there's any questions or engaging or possible, if you want to know a little bit more on a certain area, happy to dive down. I think I was telling Sarah before this started, each time I open up this report, I just want to add more and more and more. But and I know that's to get this the good meat and potatoes of everything out there. But
Do you look at any of the risky behaviors? It talks about alcohol use and tobacco use. Did you do any other drug data?
Dylan, Dylan, you examined that one a little bit. Did you look at other substances besides tobacco and alcohol? Those are the primary ones that really jumped out.
I believe I believe in the survey also discussed marijuana usage as well. Primarily just measured alcohol, tobacco, and marijuana usage among that particular population. But the rates for alcohol and tobacco were the highest among the 10th, 11th, and 12th graders that were surveyed. There were some rates of marijuana usage, but it was relatively minimal by comparison. So we chose to focus on those two substances in particular in the report.
Thanks. Dylan looked at that particular factor. So, and especially that will be, especially that particular data from the Nebraska Risk and Protective Factors Survey should be released, I believe. It just concluded, so hopefully by this fall, we'll have a new report that as well. They do district summaries as well.
Thanks again for making time to be here, remotely and in person. Want to join in on this, please contact us.
I was thinking if you get one comment that mops, they do some routines.
Is this your pen?
But then I thought you
Oh.
routines, that would be a good word, so
Oh.
that would something there, so I had to figure out a new way. I agree though, that would be a very neat place to start.
What's that?